to go ahead and continue with the assessment. We're going to test cranial nerve 12, which is the hypoglossal. We're going to go ahead and have you stick out your tongue and move it to the left and the right. Okay, and now we're going to go ahead and see if you can take your tongue, put it on the inside of your cheek, and with I'm going to take 2 fingers and push against you. Push against my finger. Good. And again. Very good. And that again is the hypoglossal nerve, and that is 12. And now we had already tested again cranial nerve 11, which was the accessory nerve, by asking him to push against resistance with the shoulders, and also with turning his head to the left and the right. We also assessed cranial nerve 9 and 10 with the uvula being midline and swallowing some liquid with the motor activity of the pharynx. And the uvula does remain in the midline with no deviation, and patient swallows without difficulty as well. This will conclude the cranial nerve assessment, and we're going to go ahead and continue the musculoskeletal assessment. We've already tested the temporomandibular joint, and we're going to test hand grips, ankles and feet, and wrist. Okay, so let me go ahead and see your hands. If you can take your hands, and we'll put 2 fingers in each hand and squeeze as tight as you can. Grips are equal and strong. We're going to go ahead now and look at your arms and your biceps. I know this arm had recent surgery, but go ahead and pull against me. That's good. And push against me. And with this arm, good, and push. Very good. Strong, both equal, bilaterally strong in both arms. Good muscle tone and strength bilaterally. Go ahead and push your knee up against me. Good. And hold your feet up here for me. And what I'm going to do here is pull against my hand. Very good. And push. And do this one. Pull. And push. Very good. Alright. And so muscle tone and strength is equal and strong bilaterally in the ankles, in the knees. And I'm going to go ahead and get you to sit straight up and kind of push against my hands here. And pull them in. Very good. Alright, now we're going to do some coordination and some balance. I'm going to get you to take your finger and from out here touch your nose. And again with this side. And now what I'd like for you to do is stand up right here in front of this camera and turn this way and walk heel to toe just for a few steps. And back again. Okay, very good. That's all very coordinated and very balanced. Now, one more test I want you to do is I want you to take your hands and on your lap, turn them over, back and forth, just like this, as fast as you possibly can. Perfect. That's good, you can stop. And very coordinated. No problems with alternating that movement. And now we're going to go ahead and move on to auscultating the abdomen. So I'm going to go ahead and get you to stretch out on the couch here. Move some of this for me. Yes. Just kind of stretch out on the couch here. And I'm going to keep your shirt pulled down. We're going to go ahead and take a listen to the 4 quadrants of your abdomen. And I'm going to listen first because before we palpate, because we don't want to get the active, get it going. Alright, just stretch your arms out for me. And just lay it here by your side. Alright. And that's very good. Vowel sounds are active in all 4 quadrants. No tinkling sounds noted. No no bruises or anything like that heard. We're going to go ahead and listen to aortic initially. Then we're going to go to the renal and iliac arteries and see if we can hear any sounds from there. All right. Initially, we have this belly button. Just above that, aortic. We have renal on both sides. And a little further down, we have iliac. Very good. And like I said, vowel sounds are positive in all 4 quadrants. Was able to hear aortic pulses. Didn't really hear renal or iliac, but I was able to hear the aortic. And we're going to go ahead at this time and do the breast exam, which is not, you know, men do get breast cancer, but it's not a common thing, and we as nurses are trying to educate men and women in the art of self-breast exam. So the way I do the breast exam is, we're going to do this with the shirt on, and so you can see, we're just going to kind of let your arm fall out, watching that shoulder. But we actually start under the armpit, and what I do is I like to go into a circular motion. So I start here at the nipple line, and I move from the inside out, and I just use the 2 fingers here, and I feel for anything hard, like a bump or a lesion that might be under the skin. And I go all the way under the arm and see if there's actually anything in there. And that's fine. Do you think you can demonstrate that same type of technique? Going in a circular motion from the nipple all the way out to the armpit.
Sure.
Okay, go ahead. Go in a circular motion. Okay. Just kind of let it slide, just gradually. Not real hard. Let it kind of smooth over. Good. And then we're going to come here, all the way down under the arm, and feel right in here. Because even this little aspect right here they can actually find some cancers and lumps in there. And that is all soft, non-tender, no lumps, no nodules, no masses. And that completes the musculoskeletal portion, the breast exam, and the abdominal portion.